Can skin really be rejuvenated by over a decade using lasers? Hey guys, Dr. Davalin, board certified laser dermatologist. Hey, this week we're talking about lasers, but actually lasers for extreme skin rejuvenation. Everyone knows about fractional laser resurfacing, the brand names of Fraxel and Pearl and all that. But look, these lasers have their place. Fractionated devices such as even skin needling. We can talk about Fraxel as in Fraxel repair, the Fraxel 1927, which is one of my favorite wavelengths, the Fraxel 1550s. But look, all of these fractionated laser resurfacing devices, including even things like Lutronic with the Infinity RF system, these are all fractional needling or fractional laser devices. So they only treat fractions of the skin, which means the results aren't as good as traditional laser resurfacing devices. So my two go-to machines for extreme rejuvenation are these, which is basically my Cyton, which I've had for quite a fair few years, and I use this in a fully ablative erbium mode. And also I use one of my favorite lasers, which is CO2. So still old-fashioned, really old-fashioned classic mode. And we use that to actually resurface skin, not portions of the skin, but the entire surface. So this is called fully ablative laser resurfacing. And I'll show you the differences between fully ablative and fractional ablative. Very simple video, and you can see how I do it in the before and afters. So stay tuned. Okay guys, here I am, geeky glasses mode. Okay, that's for safety. I gotta be responsible here. So look, this is how I demonstrate the difference between fully ablative and fractional laser resurfacing. So the first thing we're gonna do is call fully ablative. So watch what happens when I use this laser for fully ablative mode. In this mode, we're looking at full ablation. So you can see what happens with full ablation. 100% of the area is treated. Lots of smoke here, but you can see 100% of that area is treated. So you can see the damage done by that. That's fully ablative, so we're removing 100%. Okay guys, so we talked about how I used the laser in fully ablative mode. This is what we call fractional. There's so many other fractional devices we can use. Everything from, I guess, even microneedling, we can call that fractional because it's treating fractions of skin, all the way up to CO2 lasers or Fraxel lasers in different wavelengths. I can spend an hour talking about different fractional lasers, but we're just talking about the concept of fractionation. So fractionation is unlike what I'm doing, what I showed you before, and we're just treating a portion of skin. So have a look at this, guys. We're just treating a portion. Do you see that? Do you see that? We can control the portions which are treated. So that's fractionating. And the great thing with this is that I can control how much of the area which I fractionate. So for example, if I do this, only a small area is treated. And I can actually do that in my own skin, and it just stings a tiny bit, but the fractionation can be controlled. So all those little white dots are basically areas of fractionation. There is no way I can tolerate this if this was fully ablative. So all these fractional dots will heal up within the next couple of days, and that's the concept of fractionation, is to actually heal up quicker than what it takes for fully ablative. So why do I use fully ablative lasers? This is the reason why. I live in Queensland in Brisbane, and we have an extreme amount of sun damage, and only fully ablative lasers will do this job. The fully ablative laser procedure itself is a full-on procedure. Remember, I'm removing 100% of the skin surface. We're not talking about Fraxel, we're not talking about fractionated laser resurfacing, but actually resurfacing the entire surface. This way I can get right down to the middle layers of the dermis and stimulate collagen production. Over time, this tightens your skin, lays new collagen, and it's literally a wrinkle removal procedure. So I'm erasing wrinkles, physically just erasing wrinkles using this procedure. So it is an extreme procedure. It's conducted under sedation, so the patient is partially awake. I've got nerve blocks, I've got local anesthetic. Procedure is well tolerated. You can see she's not even blinking. She's got eye shields in to protect her eyes. and the whole procedure itself takes about an hour to do. So, the recovery time, this is the hard bit, and man is this hard. This is what it looks like 24 hours later. Yes, that is skin that's peeling off. There is no skin there whatsoever. That's just dermis. It's no skin at all. It's basically raw, and it takes about a week for it to heal. And over 4 weeks or so, the skin is completely healed. Remember, it heals up completely within a week, but 4 weeks later, she still has a bit of redness, but that will fade over time. So what are the before and afters like? So for extreme rejuvenation, here's my lady beforehand, and this is what she looks like about 2 to 3 months later. No fillers, no Botox were used, just plain old laser resurfacing. Before and after, you can see there's been a marked improvement of at least a decade, and that will last for many, many years. Marked wrinkling before and after, and that's after just one procedure, fully ablative CO2 laser. Before with pigmentation, wrinkles, and look at the marked improvement, especially with tightening the skin and the wrinkles after just one procedure. And again, before and afters. Once again, it's a wrinkle erasing procedure and also tightens up skin. I didn't use any fillers, no Botox, nothing, no surgeries, just laser. And once again, look at the amount of wrinkles in this lady here. And after one procedure, 2 to 3 months later, look at the marked improvement of the wrinkling. And also it's great around the eyes. I love it for around the eyes, especially for this kind of sun damaged skin before and after. That's only after one treatment and one treatment only, fully ablative laser resurfacing. Hey guys, so there you have it. You can see from the before and after why I do use fully ablative lasers. Certainly a lot of people say, hey, you know, they're out of date, but look, for the demographics or for the patients I see with a huge amount of solar damage or sun damage with marked amount of wrinkling and really bad collagen, all the other devices which I have, whether it be micro needling or fractionated lasers, therapy, marginal, that just don't work. And I do still need to use fully ablative lasers. These are drastic lasers, the downtime is huge, and certainly the recovery period is significant. But as you can see with the before and after results, they're quite remarkable. So yes, I still use them, I still love them. Patients hate me for doing them for the first couple of weeks, but look, they love me afterwards. But that's how I use fully ablative lasers in my practice. Hey guys, thanks very much for watching this video, and remember to subscribe. One new video every Saturday morning. That's Saturday morning Brisbane time, Brisbane, Australia, not Brisbane, California. So hit that subscribe button and I'll show you the coolest stuff in laser dermatology. Thanks for that. Bye. Bloody hell, that actually hurt. I'm just going to put some Advent fatty ointment. That was, by the way, that was I think 76, and there's nearly 80 millijoules, so it's, that was full on, full power on 1%. So stinging a bit, but I'm just going to put some ointment. Shouldn't have done that. Ouch. Now it's hurting. Big sook.